The United States health system is comprised of nonprofit, for-profit, public and private insurance and healthcare providers. While the majority of the country is using private insurance, mainly through employers, but private insurance nonetheless, there are a multitude of government assistance, government aid, government programs to help people get the healthcare benefits and healthcare coverage that they need. While there is coverage out there, and there are employer coverage and there is public coverage, there are unfortunately a large amount of people in the country who do not have any kind of healthcare coverage, and we'll talk about that soon. But first, I want to talk about private insurance because, like I said, it covers up 2/3 of all insured Americans in the country. Most people go through their employer where they are offered different kind of groups of policies, and they choose whichever one has the best deductible or best coverage or whatever suits themselves or their family's needs. There are some stipulations in it. I know that some companies require you to fill out a questionnaire, and if you use tobacco, then certain things are higher cost, and it just depends on what the insurance agency is being used by your company. Now, dental and vision are also kind of a hit and miss situation. Not every employer will offer that to you, but there are ways to get private insurance and private dental and vision aside from that. The Affordable Care Act, actually, if you go to healthcare.gov, the Affordable Care Act has ways for you to get your own dental, vision, and private insurance if through your employer does not work for you. And I know marriage and other life events can change your insurance status, but other than that, it's an annual change for most places of employment. The government aid and government assistance programs are available for those with disabilities. There are programs for veterans, but the ones that you hear the most about are Medicare and Medicaid. Medicare is more for your 65 years and older population, while Medicare is broken into different pieces. There are stipulations for all those pieces. Medicare Part A and B are the two more common government aids that you'll hear about. Medicare Part A deals with hospice, inpatient, short-term skilled facilities, while Part B deals more of your equipment and other short-term care. Unfortunately, there's not any dental or vision care with Medicare, and there is also nothing long-term. Medicaid does have less age restrictions, and it really deals with just low income, those in need, and does offer more long-term, more like pharmaceutical changes, and will help you with a little broader spectrum of things. So Medicare and Medicaid are both very common. You hear about them very often, but there are other things like safety nets. So safety nets deal with taxes of taxpayer dollars and like certain settings, certain hospital settings, and it helps with the low income, uninsured person in need. And then if you're uninsured and you are having an emergency, or if something somebody is in labor, they can, of course, get treatment. Uninsured does not mean that you are untreatable. It just means that the payment plan will be settled later on, or somebody from the hospital or the setting that you're in will come and talk to you and discuss those things with you. But if you're having a situation in which you need medical attention, uninsured does not mean not seen. Now, all people with and without insurances usually have a copay. Now, depending on your insurance will depend on your copay, but most specialists or family doctors or certain things like that, you have to pay so much up front, and then later on you will get the total bill or the final bill after your insurance has been seen. And again, there are payment plans because medical costs are rising and they are so hard to handle on your own. And even though there are things like the Affordable Care Act that are in place, rules change and policies change and insurances change. There's the Trump administration that changed the Affordable Care Act some. And so healthcare is ever changing and medicine is ever changing. And so insurances and policies and programs, they all change too. But overall, there is an abundance of opportunity. However, costs in medicine are still rising. They are not going anywhere anytime soon. And there is a projection that shows that by 2028, the healthcare costs of the country will be up to $6.2 trillion. So while there is insurance being provided and there are so many things being provided to people, the cost will still rise. So we definitely have to be on our toes and aware of the costs of all of these treatments. But healthcare is for all. It's for anybody who needs it.